Hey guys, Dr. Gilmore here. I don't have much time for you this morning, but I'm very upset about an event that occurred yesterday. I saw an elderly patient, very sweet lady, 76 years old. She came in with an upper respiratory infection. She'd been dealing with it for 2 weeks. She was febrile and she was producing thick sputum. She had a significant bacterial infection. This was not a cold. This wasn't a virus. This was a nice, very sweet lady with a bacterial upper respiratory infection. I wrote for her prescription for an antibiotic and some other medicines, and she took that prescription over to Kroger, our local Kroger, and was told that it was not covered by her insurance plan. Now, she's on a managed Medicare plan, and typically they do cover antibiotics, and they do, in fact, cover the antibiotic that I prescribed, which was Levaquin, 250 milligrams, number 7. Now, she was told that the best cash price, or the cash price on this medication was $200. And there's a program out there called GoodRx, which I just love. GoodRx, you guys are doing a fantastic job because you're really informing patients and the public as to what's going on with medications. But we looked online, and I'm going to see if I can't get this on here. Yeah, here you go. You can see right there the Kroger Pharmacy online price. You get a free coupon. You just click on it. They could have done this for her. $11.05. $11.05. And they were telling her that the best price at GoodRx was $194. That's absolutely wrong. It was wrong for them to do that. And instead of them doing the right thing and getting her medication for just $11, they put a phone call into our clinic late in the day after we'd already gone, and didn't call the after hours line. But basically, they just left a message saying that we needed to change the antibiotic because it wasn't covered. Now, ask yourself, why are they doing this? I think you'll come up with your own answer. But this morning I was very upset about it. I blew off some steam, and then I made a phone call to talk to the Kroger pharmacist. Unfortunately, it wasn't the same pharmacist that was on duty last night, but it was a substitute pharmacist. And I will tell you, she was absolutely on my side with this. She was very unhappy that this has happened. She was very professional, and she has agreed to help rectify this situation. But I want to bring this to light because I want all of you to know that just because somebody at a pharmacy tells you that your medicine isn't covered or that you have to do something, question them. Ask them what the real cash price is. And if they give you some nonsense, hundreds of dollars for a routine medication, then do a little bit of research and find out for yourself. And I'm going to let you all listen in on this phone call. Ashley, it's Dr. Gilmore. How are you? Good. You're at Kroger, right? One of our patients came in yesterday. Her name is. She brought in a prescription for Levaquin, 250 milligrams, number 7. And she's on a managed healthcare plan. And she was told that it wasn't covered and that the cash price was $200 and the GoodRx price was $190. So she went home without the medicine. Are those facts? Does that sound right to you? You weren't there. You weren't there, right? That's okay. Yes, you did. Right. Yeah, okay. No, we realize it's not covered. What we don't understand is the GoodRx price appears to be $11. So she went without her antibiotics and was not told that the cash price was $11. I'm not either. Yeah, even $41 with insurance is outrageous. You wouldn't actually charge the patient $41 for an $11 product, would you? Okay, I understand that. And if it's Medicare contract, that's fine. If that's what they're contracted to get, I don't have a problem with that. What I do have a problem with is a sick patient who was sent home without her antibiotic, with your company generating a phone call to the clinic saying you need to change the prescription to something she can afford, when in fact she could have afforded the medicine that she was given if you all would have just given her the reasonable price. Yeah. Yeah.
Cancel, Jocelyn.
What's the generic price you're getting? Mm-hmm. Yeah, so, yeah. So Certainly, and I appreciate that very much. I really think that whoever was working last night did a disservice to this patient, and I think you would agree if this was your grandmother or your mother, you would not like them sent home even for $50 when the real price was $11. They told her it was 194 was the best cash price they could get even using GoodRx. Um, yeah, yeah, and I appreciate you doing that. I wish you would check in on that. But let me also tell you, this isn't the first time I've had a conversation with somebody at Kroger regarding this very situation, regarding this very medication. I think you all have a policy problem. Yeah, and I understand that. Yeah, right. Okay, well, this is not the first time a patient of mine who's been elderly, number one, and number two, needed an antibiotic, and number three, Levaquin was the medication, has been sent home without the medicine because they were told it was over $200 when your advertised online GoodRx price is $11. It just seems to make no sense to me, and it looks like what's happening is that somebody is really trying to milk the system. It's what it looks like. I'm not saying that's what you're doing, but what I am saying is that okay. Well, I mean, I shop at Kroger myself, but I'm very disappointed by this. And this lady went all night without her medication for whatever reason here. So I think we all need to work together to do a little bit better job of making sure that our senior citizens get their medications. I understand. Yeah, this is falling in your lap. I understand. Okay. Well, can you get it? Can you send her to a store that has it? Okay. Right. Can I give you her phone number? Okay, 281. Okay, so thanks for watching so far. I think one of the most important things that we do as physicians is we serve as advocates for our patients. And this particular situation, this is not the first time this has come up with other pharmacies as well, so I want to be fair. But this has happened with Kroger before, specifically with this medication. I think they have a policy issue. Really want to thank Ashley at the Eldridge in 1960 Kroger for fixing this problem. She got right on it and got in touch with our patient and made sure that she got her medication this morning. So, Ashley, thank you so much for that. But for the rest of you that are watching this and are just outraged by these kind of policies and this seemingly what could be construed as abuse toward our elders, there is a customer complaint number right here, 1-800 Kroger's, Krogers. I'm sure you can figure out what numbers those go to. If you want to call Kroger and you want to give them a piece of your mind or you want to let them know they need to change this policy, I invite you to do so. I think that we need to, especially our senior citizens, that they don't deserve this kind of treatment. And certainly my patient didn't, and she was there with her prescription. She should have gotten her medication, but she was turned away because of some kind of mistake somewhere that somebody made. And I don't want to. I don't want. My purpose isn't to cause any one particular person any problem here, but I think that Kroger may have an institutional problem with their facility. This isn't the first time that this has come up. So maybe if you a number of you called and complained about what happened with our patient today, they'll look into it and they'll fix this problem. Thanks a bunch. You guys have a great day.